everything that is. So we'll move on to the last talk for today, and by Dr. Ajay Sharma, who's one of the most renowned cataract surgeons practicing in Gurgaon with of the IQ group, and he will be speaking to us on flax with the CRV Toric IOL for continuous range of vision from 33 centimeters and beyond. So Dr. Ajay, please go ahead.
Thank you, Gaurav. Thank you, AIS, for having me here. So I'll be showing you a recorded live surgery of patient. These are the parameters: 74-year male, diabetic, K1, K2. You can see at a cylinder of 1.98 diopters, and this is the toric sheet, and here, the IOL master here, where I just want to show that the lens chosen here is 25.5 diopters, which is towards hyperopic, not on the myopic side. Normally, what we usually do with other lenses, and because this is a synergy toric lens I'm implanting, this is the toric sheet calculator, and here we see the placement is in 170 degree. These will be my settings, where I'll be having a vacuum of 500 and power for 40 and aspiration rate of 36. This is a pre-recorded video. The marking here is very important. Just before you start, we need to have the patient marked properly, and we put a speculum after putting Paracane, and the patient is marked here inside the OT before we start. This is a bubble marker, and then we take the patient. I'm showing a flex here, so not a PHACO, and we will be doing a flex surgery here. Now this is the cone. The LOI here, it has two components, and you can see how the cone is being fixed, and now you can see the integral scan being done. The surface mapping is being done, and the anterior posterior surface, the lens and all can be seen properly. Now this capsulotomy here, it says the pupil is not wide enough, so we give an option of pupil maximized. And these are the marks for the toric marks which I want to show, and in just 40 seconds the surgery is done, though it is a grade 4 type of a cataract. And so here what we decided to have these mesh type of softening, where Dr. Gaurav showed was just the incision, the 5 incision there, but here we are giving the softening also. And important part is this where you will see the marks for the toric. Now this is at 170 degree, and this is what I want to show is marking will be at 170 degree, very nicely visible here also, and even on table. And now this is done. Sorry for that. And this will be, now this is the marking. You can see these 2 marks. Now this is done, and then we shift the patient to the OR. Here we can see very hard lens. Free floating capsular axis can be seen. Now this is the beauty of the catalyst machine what we have. The marks have already been done, but the 2 marks which were given by the catalyst are there. So you can, I don't know whether it will be visible here on the video, but it's properly visible to me on the operating table. The incisions again have to be very important. We try to make a triplanar ones, but definitely need to be a biplanar. You go in and then you deep down and look here. So this is what we try to do. And you see the bubbles here, because after the flex surgery, when you do this softening of the lens, that honeycomb appearance what you see, there are these bubbles. You just burp the lens and the bubbles will come out. Initially for the rexus, we used to put some visco and then take it out, but now we directly do a hydro, and then this we put some visco before starting the PHACO. Now since it is a grade 4 PHACO, we will be on the parameters of the chopping here with the 500 vacuum and 40 energy. And so this is now it is pre-cut, but definitely because it is a very hard lens, it will need some energy here. But overall energy is reduced in doing these cases because with the flax, and that is what we need to know. And so we are trying to divide, and you can see the first divide is so a bit difficult. We rotate it, and then further we want to divide it. So already cut thing, and we just are trying to chop it again. So once one segment is done, it's easy to take the other ones. Now this is done, so we can rotate in. You can see this central hard nucleus here, because whenever in hard cases you have this, even after doing a flax you'll find this. And so once this is separated, the things are easy. You can just take the lens out with the PHACO. I'll just so this is the final separation, and then the nucleus removal is easy. So one important thing is just the movement of your second hand and the second instrument. Here you see the PHACO tip is stable more or less in the center, and it is not being used, only the second instrument is being used. This is very important whenever you are dealing with these hard cans or otherwise also. We move it only when we want to take the segment out. We go towards the segment. So this is done. Not much of a IA because the lens was hard and the epicortex has come out along with it. We'll be implanting a Synergy Toric IOL. Now, as explained by Dr. Sonu, Synergy Toric is an excellent lens which we have from Johnson & Johnson platform. Now, it is a combination of a multifocal lens and a Symphony lens. Symphony gives it a chromaline technology, and it is basically a Technis-based lens, and we all know what Technis lens is. With the Technis 2 Toric platform, the stability of this Toric lens is excellent. The surfaces are square-edged and they are a bit frosted, so that's the reason the lens, once it is in the position, I'm just rotating it, and here it is in the position. So that was the 170. You can see the three dots here, and that is where you connect. You align it with the marks here, and then is just the IA being done. Now, once doing the IA, again, as cited by other surgeons as well, you have to remove the visco from behind the lenses in wherever you can, and because this again will make the lens more stable. Now, this is just to show you alignment. So at 170 degree, the lens is aligned. I'm just checking it on for the final alignment of the lens. Now, once aligned, it is a very stable lens. You don't find any problem in it. I have never seen it being displaced or moved maybe next day or even after weeks. So that's the end of the surgery. Thank you very much.
Excellent surgery, Dr. Ajay, and yes, the lens is quite amazing.